Hello, welcome to the lung page. Today we are going to see rapid revision of chest X-rays. 5 images in 5 minutes, part 1. So first case scenario, 30-year-old male presented with acute shortness of breath and right side of chest pain. So this is his history. So how can you interpret this chest X-ray within couple of minutes? So you can see very clearly, quickly with the ABCD order. Here everything is normal and you can see this here lung is separated from the thoracic wall. Okay. So what is your diagnosis for this? This is called pneumothorax. Okay. So we will move to the next question. Second question is 45-year-old male presented with fever and fluid type of chest pain. So this is his chest X-ray. How can you interpret this chest X-ray? Very quickly with its ABCD order. ABCD, airway and bones and cardiac count, everything is normal. You can see here right side there's a homogeneous opacity is there. So with that, this is called pleural effusion. Moderate to massive fluorination. This line is called meniscus sign. Okay, so when you see this type of moderate fluorination, trachea should be shifted to the opposite side, but here it's not shifted because here is basal is sometimes passive collapse. Okay, so the diagnosis of this chest X-ray is what is that? This is moderate to massive fluorination. Okay, we go to the next case. 45-year-old lady presented with fever and right-sided chest pain. Again, this case scenario, you can go for the ABCD order. You can see here is airway and also bone and cardiac conduct, everything is normal. You can see here very quickly, this is a separation of this lung and also there is a fluids is there. Okay, homogeneous opacity. And also you can't see the left diaphragm, you can't see. And also blunting of this cost opening angle is also there. And also you can see this separation. So this is called hydropneumothorax of this right side. Hydropneumothorax in this right side and also left side also there's a mild fluid effusion. So for diagnosis of this type of chest X-ray, what is that? This is for hydropneumothorax. When you see the hydropneumothorax, there's the air fluid level is there with this pneumothorax. This is called hydropneumothorax. Okay. We'll go to the fourth case scenario. 60-year-old man presented with sudden shortness of breath and constitutional symptoms and cough for 1 month duration. So what is your diagnosis and how can you interpret this chest X-ray? Very quickly, you can see the ABCD order, this airway is normal. And now you can see here trachea is shifted to the opposite side and also left side. And also you can see here right lung fluid is okay, here is full homogeneous opacity is there. And also you can see here is bronchial is cut off. So this is called bronchial cut off sign in the left side. So this is called total lung collapse of this left. So diagnosis of this chest X-ray is left lung total collapse. Sometimes because of this mass, we have to go for the bronchoscopy or CCT to identify the mass and go for the further management. So fifth case scenario is 56-year-old lady presented with one episode of hemoptysis. This is a chest X-ray. So how can we interpret this chest X-ray? As we all know, ABCD order, airway is completely normal and bones normal and cardiac control normal, diaphragm normal, everything is normal. You can see the lung field. Left side lung field problem is here. This mass-like lesion is there. With that, some crescent sign is there. This is called air crescent sign or hollow sign because more suspicion of this type of chest X-ray is a fungal board or aspergilloma. So when you encounter this type of chest X-ray, you have to take a good history if the patient have a past history of TB or not. So when you identify this type of chest X-ray, diagnosis mycetoma or fungal board. This is called air crescent sign. Okay. Now